want
review?
to develop better ways to have clinicians and patients make better decisions. They need better decision support. Doctors disagree with one another about a specific treatment. The patient's supposed to be personally responsible. How the heck can they do it? There aren't the tools, there's not the knowledge, in a digestible way to help them make those decisions.
Yeah.
If we knew, as you said before, the most cost-effective ways to treat particular conditions for particular people, and the patients knew that, and to avoid, wellness too, to avoid illness, and to manage chronic conditions the best way. If we had that concrete knowledge and could get it out there, could disseminate it in a way that people could use, both clinicians and patients, that is an absolutely essential piece for a sustainable improvement in our healthcare system. Absolutely essential, and it's not getting enough recognition.
Because doctors are afraid to have a dialogue with their patients, I think. And I think
They
that's
don't
why
have the time to have a dialogue.
or they don't have the time and they're afraid.
But personal responsibility is an issue that hasn't really come up. I mean, the thing is that I've worked as a provider, and it's very difficult to keep patients compliant. And now we're at a point where you have many millions of people who are unemployed and frankly don't have the means or don't have the insurance and also don't have the means. And besides their lack of compliance, because they just forget, or they're just the typical, everyone forgets these things. They just can't afford it any longer. So I've seen patients that are splitting their drugs in half and skipping days because they can't afford the whole process of being compliant.
But our government knows how to get this done. They recently instituted a Medicare policy that they're not going to pay for heart failure patients who get readmitted within 30 days. So what did we immediately do? We hired a physician assistant to call them the next day they go home and to make sure that they have a follow-up appointment a week later. So you can improve compliance with the right carrots.
Medical homes.
That's right.
Great
I mean,
idea.
it's not rocket science. So I want to know why our Washington people haven't made these incremental steps that I think would make huge differences. Why isn't there open competition across state lines for insurance companies? Why isn't there a defined benefit plan? What would be so difficult for Obama to say, look, it's not going to be a law, it's not going to be executive order, I just want all the insurance companies to publish in this format what's going to be provided and what's going to be paid for, what's your caps.
Can you articulate a little bit more about what you mean about cross state lines? Because if Blue Cross Blue Shield has a stronghold in New Jersey and they have an X amount of population, they don't want to go into North Dakota because North Dakota only has X amount of people. Is that? What I'm trying to achieve is competition amongst insurers so that their products in general would get better, believing in that capitalism theory. Giving people an option, that if they only have one option, whether it's Blue Cross.
Well, people in the Midwest, for example, in like South Dakota, let's pick a place, where 87% of the residents are under one insurance because there are no other insurance options.
I guess that was.
Now that's okay if there's one provider, but if there's because then they could duke it out, right? But if there's one payer and lots of providers all begging, please feed me, then the insurer sets the terms. So there has to be more competition at all levels. Providers, and measured by care, how many people do get readmitted, how many people do get the standard therapy, how many people are you vaccinating, kind of stuff. And so that's part of it. I just don't want a list of what should be covered with insurers. There should also be a list of what providers should be doing for their patients as well. So, and these, I think, are incremental steps. So, and they don't require, you're going to disenfranchise some politically powerful group, but I think the rest of them all beat up on the insurer right now. So a little thing, I think.
So what is the biggest barrier? And because I'm still very confused when I watch these healthcare debates and town hall meetings, what is the biggest barrier? Why are people so upset about the option of public option?
What's the biggest barrier in actually?
Why are people saying no to it? Why are people saying yes to it?
I think from the general perspective, and I had this conversation last night with a friend of mine who is someone who's very highly educated, who has a family full of physicians, and she was bashing Obama about the fact that there's going to be this public option. I think that the government, for lack of a better term, has fucked up everything in terms of anything that they run, they fuck up, and that's a purely technical term, I believe.
I think it is.
So